Welcome to the Death Happens podcast, an insider's guide to dying. We're your insiders. I'm hospice nurse Penny.
And I'm Hallie, hospice social worker.
Today's guest is Javeeda. Javeeda lives in Canada and she has a terminal illness. She has decided to exercise her option to utilize medical aid in dying, and she's going to be talking with us today all about that. But first, I think Hallie is bringing our hot topic of the day.
Well, since we're going to be talking about medical aid in dying in Canada, I thought we might talk a little bit about the changes that have happened recently in Washington State for our medical aid in dying program, the law known as Death with Dignity. I was actually at the open legislative sessions that were talking about the changes they wanted to propose, one of which was changing the wait time from 15 days to 7 days. And the other part of that had to do with medications being accessible and accessible doctors moving from just MDs to PAs and ARMPs.
So I believe last year they passed the nurse practitioner, right?
They
But
did. That was all in one.
Yeah, and I knew that they shortened the waiting period at the end, right? Like there's the oral request, and then I think it's a 15-day waiting period for the first written.
Not anymore. It used to be.
Okay.
So before, when the law started, it was a 15-day waiting period and a 48-hour wait period after you do your last written request.
Okay.
Now they have taken away the extra 48 hours for the written after the written, so it can be 7 days total.
Oh, okay.
And
So,
as you know, there's good reasons for that, right?
yes, absolutely. I do know that because of a tragic situation with a patient that I cared for who had liver cancer and was trying to make it through that waiting period before his disease progressed to the point where he was no longer able to make decisions and considered eligible for the, I guess not program, but eligible for the process or for the law, and did get very, very confused and was not able to carry out his plan. And it was really a horrible experience for not only him, but for his whole family.
Yeah.
So that's so interesting. I am a volunteer for End of Life Washington, although I haven't done anything actively yet. I'm just going through the training program and just went through the training program last month when it was still a 15-day waiting period. And so now they're going to have to retrain everybody to say, nope, not 15 anymore. It's now 7.
Yeah. Well, and one of the things that was interesting, I think about, people think that Washington is this big blue bastion of liberalism. And and that's not the case. We're definitely a purple state, if at best.
Yeah.
But one of the things I was thinking about as we're going into the session is the arguments against the MAiD law, Death with Dignity law in Washington, altogether, frankly, but especially when the 7-day change was about to happen. And I particularly remember there was a disability lawyer who was actually disabled himself.
Seen him.
You know this?
Seen him. Yep.
And he made great points. I think the nuance is that he was speaking to ableism in general, which absolutely is an issue. And he was making the argument that people just aren't comfortable with needing assistance, and that's pushing people towards ending their lives.
Yeah, I don't know if I believe that take. So I know who you're speaking about because Compassion and Choices asked me to speak at the hearing last year. They asked me for a testimony, and I ran out of time. They ran out of time, and I wasn't able to. I submitted my written testimony, but he was there, and I get what he was saying. However, I have a niece who is 26 years old. And when she was 13, she became paralyzed from the waist down due to an infection in her spine. It was tragic, just very, we have no idea what happened, but she became paralyzed. So she is now in a wheelchair.
Yeah.
And her quality of life is amazing. She put herself through college. Well, she didn't put herself through college. Her parents paid for it. But she went to college. She got her master's degree. She just got a job. She does children's, she's a child therapist, and she works in a
Amazing.
school. She drives her own vehicle. She's got a van with a lift, and she's just adorable. She's hilarious. She jokes about she says, I don't care if you call it a disability. It doesn't bother me. She
Yeah.
jokes about that. She jokes about, how she's got the advantage being in the wheelchair, like when we're in Vegas and we're getting around and she gets to be in her wheelchair. And every time she gets in her wheelchair, it doesn't matter if she thinks anybody's watching her or not. It's the cutest thing. She always goes, wee, when it's so cute. I mean, she has just, so she's not somebody who's like, I feel like could ever be, I think if you have that propensity for that kind of state of mind, you're going to have it whether you're disabled or other than abled or not.
Have a disability.
Yeah. Have a disability or not. But I mean, I know you feel the same way. My philosophy is if you don't agree with death with dignity, don't fucking do it. That's your choice.
Yeah.
You don't have to do it. I know there are people who think, well, we're going to start euthanizing people, they're going to get to a certain age and we're just going to go ahead and put them down like the old dog. And I mean, we can't even pass the law federally. I can't imagine that we'll ever get to that point. And the other thing I want to say too, and Javeeda will be able to tell us, I think, a little bit more about her process and what she's going through in Canada. The biggest difference, as far as I'm aware, between Canada and the United States is that in Canada, it's actually euthanization or euthanasia. A provider administers the medication to the person that ends their life. And in the U.S., it is not. It is the person has to consume the medication themselves, which is kind of limiting for people with certain, terminal diseases. But that's the difference. And I think if you do kind of get to that point where it becomes a provider administering the medication, that could be a slippery slope. I could see where people would worry about that. But we're not there. And I don't even think we're close to being there.
Well, maybe someday we will have our own whole episode about medical aid and dying in Washington and what all that entails. But for now, I'm excited to talk to Javeeda.
Yeah, let's do it. Welcome, Javeeda. We're so happy to have you here. Why don't you let's start with why don't you tell us a little bit about yourself?
Okay.
Where are you?
My name
Who
is
are
Javeeda.
you?
Where am I? I am a 52-year-old mom of one, currently living in the Greater Toronto area of Ontario, Canada. I was born in Pakistan, and I came to Canada when I was 2 years old, so years ago.
You already told us your age, Javeeda.
Yeah, but some people can't do math, okay? I'm the youngest of 5 siblings. I'm the baby. For 2 brothers and 2 sisters, and I have 14 nieces and nephews.
Wow.
Yes, a very big family, and they're all adults, and some of them have children as well. My parents both passed away from cancer. My father died from colon cancer, and my mother from ovarian cancer.
Oh, doggone.
Yeah. So cancer
How
is
old were
nothing new
they?
to us. My mom was 55, and my dad was 70.
Wow.
Yeah, so my mom was quite young. Although she seemed old to us. But
right?
Sure.
I know. I remember my mom at 50 and thinking, oh my gosh, she's so old. And now I'm
so old.
in my 60s.
And now I'm 52, and I'm like, she wasn't that old.
Right.
Right?
Yeah.
I've got a large network of extended family and friends who are always there to support me. I have the title of number 1 aunt and biggest Duran Duran fan. Yes, yes, I am.
Yeah, 80s music.
Don't fight me on it. I'll win. And I'm currently trying to enjoy life day by day after my diagnosis of adrenal cortical carcinoma.
Okay, so let's talk about that. that is a type of cancer.
Yes.
Right? Carcinoma is a cancer. Do any of your siblings have any cancer?
No, not at the moment, and hopefully never will.
So
Mhm.
you won the jackpot. You won the lottery.
It's okay. I got the good looks lottery too, so that's okay.
So tell us about your cancer. For those of I'm not even familiar with that one, to be honest. I'm trying to think of Hallie, have you ever had any patients with that cancer?
We've had it, but I'm not super familiar with this. It's
Yeah,
pretty rare for us to get people with that.
Yeah, I don't think it's a very common cancer.
No, it's not. It's affects about 1 in a million people.
You did get the
Yes,
lottery. Did
I
you buy a
did.
lottery ticket after you got your diagnosis? I would be out there
don't even know.
spending
I
my
hit
dollar and
double lottery because when they tested the tumor, they found a genetic mutation that caused my cancer,
mm,
and the genetic mutation only affects about 500 families in the world known to have it.
Oh my gosh.
And I'm only the second person in the world. I'm in the endocrine pathology book as well.
Oh shit.
Yes,
wow.
I'm only the second person known to get adrenal cancer from the Birt-Hogg-Dubé syndrome.
Wow.
Wow.
So what kind of symptoms did you have or do you have with this? I'm really fascinated by like how were you diagnosed? When were you diagnosed? What symptoms were you having?
Like
You
what
know,
led you to get checked? Yeah.
yeah.
Right. So all the symptoms I can tell you about in hindsight,
Mm.
after you get the diagnosis and you say, oh yeah, I remember I had this and this and this. But what led me to go get checked was um, in 2020, at the end of 2020, I was having some really bad back pain.
Mm.
And, if we get back to what did I do before and all that kind of stuff, I'd been in a couple of car accidents.
Mm,
So I thought maybe it was just some pain from that coming up. So I ignored it. And then a few months went by and I got it again and I just ignored it. And then a few more months went by and then I couldn't ignore it anymore. I had back pain, but then I was
Mm.
also getting stomach pain and I had really bad stomach pain. And it was COVID time, so I had a telephone appointment with the doctor and he said, "Okay, come in." And he examined me, told me to go to the hospital, don't leave until you get checked out. And, the state of the hospital systems in Ontario is very bad. And I wanted to leave, but I stayed. And good thing because they said, okay, you have gallstone, but we see something on your liver. We're going to
Mm.
keep you in for a CT scan. We don't want to do 2 surgeries if we can only do 1. So they kept me in. They did the CT, and there was something on, they still said the liver.
Mm.
And then they sent me to another hospital. They set me up with another hospital. And it was, like I said, it was COVID time. I never went into that hospital. When they did their reviews of all the scans and everything, they determined that it was an adrenal tumor. And I had it
mm,
removed, and my gallbladder, and some of my liver, and the adrenal gland itself. I had all that
Mm.
removed in one surgery, 6 weeks from the time we found it.
Wow.
wow, that is a lot.
Yeah, it
And
was
I can
kind of like,
imagine that being a similar story to people like, oh, back pain, it could be something else. Or even
Oh
going to the
yeah.
doctor and saying you have back pain or stomach pain, they might not catch something like that.
yeah, and like I said, it's so rare. Who's going to think that? Who would think
Right.
that? And then some of the symptoms in hindsight, because it's the adrenal gland releases all kinds of hormones and things like that. I was getting facial hair here, and I
Mm.
thought I'm getting old, right? Old ladies, we get
Mm-hmm.
facial hair.
Mm-hmm.
And I was shaving it, and it was thick. Like, it
Mm.
was really thick. And I was like, what the heck? Every week. But it's called hirsutism, hirsutism.
Yep.
Huh.
Yep.
And it is a side effect from the adrenal cancer. So,
Wow.
it was too much. I should have just had a few that I had to tweeze, but I was shaving thick amounts. So that was one of the symptoms I had on hindsight.
Mm-hmm.
So once they took where are you at right now as far as treatment and prognosis? Are you undergoing any more treatment? Did you have to go through chemo? after the surgery?
Yes. So first, when they did the surgery, during the surgery, the tumor spilled a little bit, so they washed it, they did the lavage or whatever, and tried to get as much out as they could. And so always remembering this is COVID time. So the surgery was in November,
Mm.
and um, apparently all of the pathologists were busy doing COVID tests and stuff like that. So they
Mm-hmm.
didn't get around to finish testing my tumor until around February of the next
Oh,
year.
wow.
Wow.
Yeah. And at that
Yikes.
time, yes. So that time, that hospital where I had surgery done, they said it was low grade, and they referred me to Princess Margaret Cancer Center, which is well known in Canada and many parts of the world as well. Their doctors there, they like to perform their own pathology. They said it's high grade, and I started seeing an endocrinologist first. And he told me, no, you're okay. We're going to put you on mitotane just as preventative for
Mm.
1 to 3 years.
And what is that,
And
mitotrain?
mitotane is that drug DDT that they use to kill
Oh,
weeds and stuff like that.
wow.
It's an old drug. It's the first line of defense in most cases for adrenal cancer, ACC. So they put me on that, and that is a horrible drug. It is a horrible medication.
Mm.
It makes you feel sloppy all day. You're
Mm.
lethargic. You wish you were dead because what is the point?
Mm-hmm.
I didn't like it. And I tried to get up to therapeutic levels, but I just didn't like it. And I said, no, thank you. And then my doctor and I discussed chemotherapy. And so remember at that time, he said I was going to live. I was going to live, no problem. But then when I had my next scans done and it had spread to my spine, one
Mm.
tumor in my spine. So now they said 3 to 5 years based on
And
data.
and this is
I
2022 at this point?
This was 2022.
And
Yes.
how I'm just putting this all together in my mind for your timeline. And you said you're a mother of one. How old was your child at this point?
In 2022, she was I don't know, she was 12, 13,
Wow.
14,
Okay.
14. She's 16 now. She just turned 16. So
Okay. So still
yeah,
in her
she was,
teenage years, though.
Yeah.
yes, still in early teens. So the tumor was removed in November 2021. I started adjuvant therapy in around April 2022. They found another tumor in my spine in October 2022.
Mm.
That's
Mm.
when it went down to 3 to 5 years. And I did radiation on the tumor. And then in April 2023, and somewhere in between, I think in January, they found metastases in my liver and spine.
Oof.
So now they said 1 to 3 years. Because I'm always asking. They're not telling me that. They're not giving it to me. I'm
Right.
asking,
Of course.
Mm.
Yeah.
right? 'Cause I want to know. I want to know what do I have time left to do? How am I going to spend my time and my money?
Yeah.
Um, right? So then I did. I had a vertebroplasty because I had a fracture in one of my spine, in one of my vertebrae. So I did a kyphoplasty in April 2022. And then in July 2023, I had done no more. I did actually, sorry. And then in July, in between May and July, I did some immunotherapy. So I did 3 treatments of Keytruda,
Mm.
and it failed.
Mm.
So then they gave me months, not year, in
Mm-hmm.
July of 2023. And then they said, do you want to try lenvatinib? It's an oral chemotherapy. So I said, yes, I'd like to try that. And I started at 8. I think they started me at 10 milligrams. It was too much. And I went down to 8. Then I went up to 10, and I'm currently on 14 milligrams. I've luckily had no side effects. That's why I'm continuing on it. And it's working.
Yay.
Yay! Finally,
So
some good news.
finally some good news, right? We do scans every 3 months, abdomen, pelvis, and spine. And I had a second vertebroplasty in, I did one in April and one in November last year. So two in the same year because I was walking like this and I had more, my vertebrae were collapsing. So they tried to put in more cement to give me some better posture and it worked for a while, but it's not working anymore. I'm finding that is not getting better
Okay.
for me.
Hey, you don't fuck with the Javeeda.
You don't fuck with the Javeeda.
She was fabulous.
She was great, and that was really enlightening. There were definitely some things about the Canada medical assistance in dying law that I did not know about. I think that Audrey's law, the waiver of
Yeah.
consent, I mean, that's fabulous. I love it.
Yeah. That is super interesting. I cannot even foresee in our lifetime that happening, not even
No,
federally being recognized. So,
no, it's really unfortunate, but I do agree that it may happen someday, but not in our lifetime. It's just too
yeah.
controversial. All
Well,
right.
she's doing
Well,
a fantastic job of living the words that we try to say at the end of this podcast every single time.
yes, absolutely.
She
She's
is remembering to live because
yes.
someday
We'll all be dead.
When I went on lenvatinib in August last year, they told me that the efficacy is about 6 to 8 months based on data. And I understand everything is based on data, and individuals may vary.
Mm-hmm.
So right now, I would be in month 7 of taking the drug. And it's working. Like I said, my tumors are either shrinking or they're stable, but there are no new tumors.
Oh,
And
that's
That's
that's a
great.
win.
awesome. Yeah.
Yeah.
That's a win.
So when they say what was 6 to 8 months, so is this something that will ultimately cure the cancer, or it's just prolonging your life? It's just prolonging your life. Yeah.
Yes,
Okay.
it's
Mm.
So,
I have been diagnosed with a terminal stage 4 adrenal cortical carcinoma. So this is
okay.
all just to give me quality and length of life.
Mm.
Right. Okay. And that's great. So it's you're not because what happens, I mean, nowadays some cancers really are more of a kind of a they're terminal, but they're treated like a chronic. You look for the 5-year survival rate and you can take the medications that will help you to live at least 5 years,
Mm.
but it does often boil down to, are the side effects worth doing them? Like, well, how is that
Right.
going to impact your quality of life? So it's great that you're not having any negative effects so that you can get, more time. So what do they say your prognosis is at this point, or do they know?
Yeah, so we've gone through all that of how I went from you're gonna live to now you have months, not year.
Yeah.
So
Mm-hmm.
every visit I ask them, how much time? How much time do I have? And I've asked my oncologist to just be frank with me. Don't hide any shit from me.
Mm-hmm.
Just give it to me straight. So we do. And the last few visits, we've always ended up crying. But I just saw them on Tuesday. And this visit, we were laughing because part of my Bert Hogg Dubé symptoms is um, lung cysts and a possible lung collapse.
Oh my
And
gosh.
I had one showing up on my scans on February 21st. And I had a vacation planned for March. And the doctors told me don't go. And I said, bye bye, I'm
Yeah.
going.
Yeah.
If I'm gonna die on the way there, fine. If I go there and I die on the way back, I had a vacation. I don't really care.
Yeah.
So I took my chances, and just before I left, they did an X-ray and it was gone. But they recommended don't fly for 6 weeks. So anyways, I went and I had a great time. So I don't know where I was going with this, but
your last visit, you asked what
yes.
your length of time was.
So I lose myself. So I asked,
That's okay.
and the doctor was laughing with me about how I went on the trip and all this stuff. And they said, listen, the medication's working. Let's not talk like that anymore. We're always going off data, not people. And we'll just take it scan by scan, month by month, 3 months by 3 months, and go live your life. So, it's, like, obviously, still no cure.
Yeah.
But let's use what's working. Let's go with what's working. It's my last hope.
Right.
Yeah.
So at one point, though, when you had months left, you did apply for medical aid in dying, did you not? Yeah. And
I
were
did.
approved? Yeah.
Yes.
And were approved for it?
Yes.
So Hallie and I were talking a little bit before about the differences between medical aid in dying in Canada and in the US, where in the US, the person has to be able to consume the drug by themselves. They have to be able to self-administer. And in Canada, a provider gives that medication to the person. So that's a big difference. But do you know what the criteria is in Canada to be able to do medical aid in dying?
I do, and it's okay if I read because I don't want to spread any misinformation.
Yes,
And
absolutely.
just to your point, medical assistance in dying in Canada, you do have the option of self-administering as well.
Oh,
So,
okay.
yes,
Okay.
there's
That's good to
you
know.
can do both.
Okay.
Okay, you have to be found eligible. And in the past, I think before 2016, I could be wrong on that, and I'll see if I come across it here. It was a criminal offense to help somebody, and a doctor could be charged under the Criminal Code of Canada. And we have 3 different levels of government in Canada. We have the federal government, so they deal with laws and things that affect Canadians as Canadians. And then we have provincial legislation. We have 11 provinces, so they have powers for certain things like healthcare. And then we have the municipalities or cities, and they deal with parking and all those kind of things. So medical assistance in dying touches on the federal and the provincial legislations. So there are 2 methods of medical assistance in dying. Method 1, a physician or nurse practitioner directly administers a substance that causes death, such as an injection of a drug. Method 2, a physician or nurse practitioner provides or prescribes a drug that the eligible person takes themselves in order to bring about their own death. So, like I said, 1 or 2. Then, you must meet the following criteria. You must be eligible for health services funded by a province or territory or the federal government. You must be at least 18 years old and mentally competent. You must have a grievous and irremediable medical condition. You must make a voluntary request for medical assistance in dying. And you must give informed consent to receive medical assistance in dying. Generally, visitors to Canada are not eligible for medical assistance in dying. They don't want death tourism here. I learned that while I was researching. I know. You learn things, that you can share with other people and you didn't know about. So, what is a grievous and irremediable medical condition?
That's our next question.
It's okay. We got it all here. You must meet all of the following criteria. You must have a serious illness, disease, or disability. You must be in an advanced state of decline that cannot be reversed.
Mm.
You must experience unbearable physical or mental suffering from your illness, disease, or state of decline that cannot be relieved under conditions that you consider acceptable.
Mm.
That's fascinating language.
Yeah.
I know, right? And they have it, well, I highlighted it, but they are me here. You do not need to have a fatal or terminal condition to be eligible for medical assistance in dying.
Wow. That's a
I,
big difference.
I had heard that, yeah.
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 Now there's controversy going on in Canada right now. If your only medical condition is a mental illness, you are not eligible for medical assistance in dying until March 17th, 2017. So previously it had been this year, February or March, and the government had pushed that back from, I think, 2016 to 20 something to 2024, that if you had a mental illness, you could apply and get it. But now they pushed it to 2027. So if your only condition is a mental illness, but then you can't be eligible until 2027. But if you have mental illness and something else, then you can apply. You still have to get approved, but you can have that. Yeah. So that's what the next line is.
Yeah,
There.
I hear a lot of people on social media in my comment section when I do a medical aid and dying video say that, oh, in Canada, you can do it if you're depressed or whatever. And I was like, no, I don't think so. And I did reach out to Dr. Sammy Winemaker. I don't know if either of you know her. She is on Instagram. She's a palliative care doctor. And I want to say, I think she is in Toronto, and she sounds just like you, Javeeda. She's got the same accent, which I love because my mom is Canadian and my family was from Canada. So I love that accent, but that's totally a side note. My point was that Dr. Winemaker said, no, it hasn't happened yet. It's very controversial. It's likely not going to happen because of the controversy around it. People are thinking, oh, if you're sad, you can go in and just, get the drugs and off yourself that way. And it is quite controversial. So you're approved. Are you still approved, even though you would be, because you don't have to be terminal, right? I mean, you are terminal, but you don't have to. So in the States, you have to have a life expectancy of 6 months or less.
Okay.
That's the required terminal illness with a life expectancy of 6 months or less. So you were approved, and now you can just put that on hold. But at any time, would you have to reapply, or can you just at some point, if you started to get worse, you weren't responding to the drug anymore, would you be able to just pick up from where you left off and go, okay, now I want to do this, or would you have to reapply?
No, so once you're approved, you're approved. So that's it. That's done. But what we do have is a waiver of final consent. And it's also called Audrey's Amendment. So there was a woman named Audrey Parker. She was in Nova Scotia, and she had applied for MAiD, and she died November 1st, 2018. She didn't want to die then because she was still lucid. She was still alive and living. But at the time, the Canadian law was you signed up for MAiD, you picked a day, and you had to die on that day.
Oh, shit.
Because, you had to die because you couldn't be, if you became unable to consent at the end of your life, you weren't eligible because you had to give consent at the end. So if she waited until she was no longer capable, she may have been at that fine line, today she could give consent and tomorrow she couldn't, and now she couldn't get MAiD. So basically you sign up and you had to die before you were ready to die. And her dying wish was that Canadians would band together to make that go away. So now we have a waiver of final consent. So what that allows us to do is sign up for MAiD like I have, be approved like I have, and now every 6 months I get in touch with the doctor who's going to administer, who could, if I choose to, take MAiD. We meet up every 6 months. We just talked on Monday to re-sign the waiver of final consent. And what that does is it allows me to not have to consent at the end.
Wow.
So, for example, between now and September 21st, 2024, that's the date my waiver final consent is good until. If I get to a point where I can't consent anymore, somebody can call on my behalf and say, "Doctor, please come and do this." And she will come. Now, she will still speak to me as if I'm there because they don't know.
Mm-hmm.
And she will ask me if this is what I want to do or if I don't want to have this. I can't remember which one. She will make one final request of me. Now, the contract is between me and her, nobody else. So what the law says is that if a person makes an involuntary kind of motion, so if she inserts a needle and I go like this, that is not to be construed as a withdrawal of my consent. That's
Wow.
just an involuntary thing. So
Mm-hmm.
let's say my family is there and they say, look, no, she doesn't want it. She doesn't want it. It's up to the doctor and me. And so she has my waiver of final consent. She says, no, that is an involuntary movement. She can continue with the doses. So the waiver of final consent is very important. It's very important to have it signed and keep on top of it every 6 months.
That's what we don't
I
have
have
in the
so many
States.
questions.
Yeah, I wish we had that in the States because so if you have a terminal disease in the US that is a long prognosis that will end with a period of time where the person is no longer decisional. So for example, Alzheimer's dementia, Huntington's disease, anything that has a component that is going to cause that person to not be decisional within that last 6 months of life that's required for medical aid in dying, they can't utilize it because at the time that they're within that window, they can't consent anymore. So I've always thought, and I never, I didn't even know about this waiver of consent, which I think is brilliant, that if somebody has Alzheimer's and they say, when I get to this point where I have, where I meet the eligibility of a life expectancy of 6 months or less, and I'm wearing diapers and I can't feed myself, I want to have medical aid in dying, they're not able to do that. But if they had that waiver of consent, they could make that decision early on when they were still decisional.
Yes.
So, and I know, Hallie, you have questions, but I have another question. So for you, who is your person that would call the provider and say, she is losing her marbles now, and I would like to be able to go ahead and, have her exercise this waiver of consent and utilize medical, I guess it's medical assistance in dying is what they technically call it in Canada. Do you have a person? Is it your child? Is it a sister, a brother, or do you have a person who's been designated to do that on your behalf?
This is still an ongoing discussion
Mm.
because it's not easy.
Mm-hmm.
It's not easy to ask somebody
Yeah.
to do that for you
Mm-hmm.
when they feel that. Well, I mean, I know you may ask me later on about how my family and friends feel, so we can talk about it then. But as of this moment, I have talked to one person, and they have agreed. I won't say who it is.
That's okay.
Yeah.
And I just want to take a pause and realize that, yeah, we're talking about this in more clinical terms, but this is your life that we're talking
Mhm.
about.
Yeah,
And it's
Yeah.
okay to take a moment and be sad. This sucks.
yeah,
This
Yeah.
fucking
yeah,
sucks.
Yeah.
yeah. I'm very like, I want to spread the word. I want people to know not about just medical assistance and dying and things like that. And like you didn't know about waiver of final consent and things like that, but
Right.
life is a gift.
Mhm.
Yes.
Let us enjoy it.
Yeah, and that is the message that I get from your social media videos, from your TikToks, is that
Thanks.
you are, you know, um, sending that message to people. You get as much time as you get, and you need to really make the best of it.
Yeah,
You take those vacations when you can.
Mm-hmm.
that's right.
And what I
No,
love about your videos is that you are very you are very much focused on it is quality of life over quantity of life, and that is why you made the decision to utilize MAiD when the time comes, because you recognize that once your life has no quality left, then it's not worth living anymore. But in the meantime, you make the most of it, and you're doing a lot of fun things.
exactly. That's always been my number one because you see your mother go through it, you see your
Mm,
father go through it, you see friends go through it, you see friends' parents go through it. Um, why would I want to be here if I'm lying in bed
Mm-hmm.
and uncommunicative, if that's the right word, and
Yeah.
mhm.
just there, being fed through a tube,
Mm.
machines and stuff like that? I'm not alive, and we can get into all that stuff, and I know you guys have other questions and that will come up there. But yeah, when the quality is gone, there's no point. I'm not, people think that people want to just pull the trigger. Like, look at me. I'm trying to manage my pain right now. Uh,
Mhm.
I'm trying to work out what's my best combination of the pain meds, but I'm still getting up. I'm still walking. I showered. I did this. I did that. I'm not ready to die.
Yeah. Absolutely. I think that's the great focus of all of this is even though people have the option to use it, doesn't mean that they don't want to still live.
And
Well,
it doesn't mean that they have to use it. Just because I
Yeah.
right.
signed up, the doctor told me 66% of the patients never use it.
Yeah, and in the US, same thing, it's an option for people. People need to feel that they have that option and that control should they want to use it. It's hard when you're dying and you're losing so much control over everything in your life. At
Mm-hmm.
least if you have that little bit of control, it makes you feel like you do, you are in charge of your own life and your own death.
Exactly. 100%.
So I'm
Right.
thinking of our own state laws and how we will never have the waiver here. We can't even get this federally approved, let
Yeah.
alone
Yeah.
have it be when you're not able to make your own decisions.
That's right.
It,
Because
it
it's
does.
not available in all states.
It's
No.
no
No.
10 and Washington D.C. right now.
Yep. They're trying to legislate it in a lot of different states, but it's not. It's very slow.
Yeah. I think we'll see legalization of marijuana before we see death with dignity
We
or
Mhm.
have
medical
that
aid dying.
too.
We do in Washington.
Yeah.
Now that I don't smoke anymore.
Yeah.
I'm just thinking about how tricky that waiver is with when we're talking about having the option and not having to take it, but then when there is a plan for and that's really when you're not just wanting it for a safety net, but you're definite on your plan, and then you have someone designated to work with your doctor on that. So
Mhm.
I'm very grateful that you guys have that up there. I just can't see that ever being an option where we are.
Yeah.
Yeah, that's really really sad because you guys have the drugs. It's not any special drugs.
Right.
It's just, you know, should we say higher doses of them? Like,
Yeah,
um,
I was a different drug when we first started. And then there was some controversy about that drug being used for capital punishment. And so we stopped being able to get it. And so
Well,
pharmacists
it was
had
the
to come up
cost
with
too, wasn't it? The
it.
cost, it
Was
shot
cost
up in
also.
cost to like $3,000. And of course, insurance won't pay for it.
Mm-hmm.
So people couldn't afford it. It wasn't
That's
accessible.
crazy. You know, insurance will pay for your long-term treatment, thousands and
Yeah.
thousands of dollars, but they won't pay for this one shot. It's just
Yeah.
like so many other things. Give me one shot of prevention
Mm-hmm.
instead of millions of dollars in treatment.
So did you, so was this something that you ever discussed with your daughter? Does she know your intention, or did you not talk to her about it because she's still young and, you're still
You know,
mommy?
a year and a half has passed, and
Mm-hmm.
I'm pretty sure that I directly have not spoken to her about this because she was too young at the time, and
Mm-hmm.
have gone through so many things. I have kept a lot of it away from her, but as she's getting older and I am getting worse, um, even though it doesn't seem like it, I am getting worse. I'm trying to bring her in the loop a little bit, and now she sees my TikToks.
Yeah.
Um,
I was going to
so
ask if she follows
yeah,
on TikTok.
well, she told me that she's not following me on TikTok, and she was mad that I had more followers than her because Penny gave me all these followers. Yes, she was really mad. And then when I went on vacation and more than somebody was making all kinds of rude comments about my body and deflating boobs and all that kind of stuff, she said she got mad. And then she's like, wait a minute, that's my mom. She can deal with those people. She doesn't have to go and make those comments about them, right? So first she says she's not following me, and then she knows what's going on. So I don't think
Typical
I've
teenager.
Yeah.
right, trying to be sneaky and things. So I don't believe I've talked to her about MAiD, because she was too young, and I don't want her to think I'm taking an easy way out. She's too young to understand all the nuances. So I haven't discussed it with her, really.
That's an interesting take on that, the easy way out. And I think I hear people say that too, like it's the easy way out. How can anybody think it's the easy way out to make a decision to end your own life? That is not easy at all.
Mm-hmm.
It's
And if
not easy.
and if it is the easy way out, so fucking what? Who cares? If you are suffering with a disease and your quality of life is shit and you decide that you want to take the easy way out, there is nothing wrong with that, you know?
Exactly. I'm the one going through the suffering. I know how much I'm suffering, and I know how
Mhm.
much I'm hiding from you
Yeah.
Mhm.
for
Yeah.
Yeah.
you,
Yeah.
because if I don't, you're going to be on my doorstep every day, not living your life.
Mm-hmm.
So, not that I've been lying, family, friend. I do reach out when I need help, um, but at my comfort zone.
Mm-hmm.
Like when I think, okay, you know what? I need help with this. I'm going to ask somebody. But I'm not the type. I've been very independent my whole life, and it's not going to stop now.
Mm-hmm.
I'll take the help when I need it, and not before.
Mm.
Losing independence is hard I can't think of any patients I've ever had who were okay with losing their independence, even those who like to be dependent on others. And there are some people who love to have everything done for them. And even those people have trouble with losing their independence. It's really hard.
Yeah.
It is, and if somebody said they wanted to come and clean my house every day and wash my dishes and do my cooking and cleaning, I'm okay with that. But like I
Me
still need to
too.
be able.
Me three.
I think everybody, right? All of us would be
Yeah.
okay with that.
Yeah.
But the day that I can't like jump in my car and run for Starbucks or go anywhere that I want to go, and lost most of that kind of independence,
Yeah.
that's the day when I know I'm slowing down, and I'm going to make sure my waiver of consent is up to date and everything like that.
Mhm. Yeah.
Wait. You're going to Starbucks and not Tim Horton? Are you Canada?
Yeah.
Are you
Wait,
Canadian
what?
for real?
I love,
So
so I live near Canada and I've been, It's actually closer for me to drive up to Grand Forks, Canada, to go to their grocery store than it is to go to the biggest grocery store that's where I live, because I live on a mountain in a very small town. But there's a Tim Hortons up there, and I went up there last fall, and that is the best damn coffee I've ever had. It was so good. And the donut, like some kind of
Yes,
donut that I had, it was like, "What? I need to come up here more often."
we do. If I'm drinking coffee out, I will drink Tim Hortons. But
That's a backpedal right there for all of our
yes,
Canadian watchers.
but my niece introduced me to iced caramel macchiatos at Starbucks.
Starbucks sucked you in.
Yep.
Oh gosh, and okay, I did go 4 times to get one. I always tell them to put a thick layer of caramel at the bottom because I don't want the coffee part. I just want the caramel. So that's why I'm going to Starbucks, just for the cold drink. But if I don't like Starbucks coffee, none of them, not even the blonde.
Yeah.
Coffee, Timmy's, but
Iced
they
caramel
know
macchiato,
this
Starbucks.
morning I went to Starbucks and there's always different people at the drive-thru, and I was like, "Hi, can I get a tall iced caramel macchiato?" They're like, "With a very thick layer of caramel at the bottom." I'm like, "Yeah, you know me."
Now, see, we got to figure out how to get you all the parts of a macchiato without the coffee, and then you go to Tim Hortons and you pour the coffee into the caramel macchiato.
That might be cheaper. I tried to we go cross-border shopping. We tried to buy the Toroni caramel syrup, but it's
Oh,
not the same as Starbucks.
no, it's not the same. It's not the
No.
same.
Yeah.
So speaking of fun things to do you have a bucket list, and are you doing your bucket list? Because like now's the time, right?
Yeah.
I mean, now's the
That's right.
time whether you're dying or not, but
Yes.
Yeah,
what kind
for
of
sure.
things
So
are you wanting to get accomplished before the end of your life?
my bucket list was small before. Number one was to see Duran Duran play live in London.
Did you? Oh my
Yes.
gosh.
Yes, I did. And
Oh
the
my
number two was to go
gosh.
to Italy. So I did both of those in July 2022. I planned
Amazing.
my
Wow.
European trip around a Duran Duran concert.
Oh
Saw
my
their first date.
gosh.
Okay, we'll do this before, we'll do this after. And that was that. Then I've always wanted to go to New York City at Christmas time to see
Mm.
the Rockefeller tree and everything. So I did that in 2023, January.
All
Um,
right.
so pretty much that was my bucket list. Like I don't have big things, but I do still want to go to Paris and Versailles. I
Mm.
was going to go this May, but the Olympics are happening this year, and there's
Oh.
all kinds of stuff going on in Paris right now. It's just not the right time to go. So if I'm
Mhm.
still around next year and I'm well, then do that next year. Yeah.
Yeah.
Okay,
Um,
so how did Simon Le Bon look, and more importantly, how did he sound?
Okay, from
okay.
that face tells me everything.
I went alone. Okay. I took my daughter to Europe with me, and my cousin was going to come to the concert, but she bailed. So I went alone to Hyde Park. It was the British Summertime Festival. There was
Wow.
80,000 people there. I didn't know this before, otherwise I may not have gone.
Wow.
So they were headlining. So I went to Hyde Park and I left before the concert was over. I left at before the encore because I was
Mm.
not leaving with all those people.
Yeah.
So that was July 2022 and it was amazing. And then that was in England. And then in August they came to Toronto, so I saw them here.
Oh,
And then just September 2023 they came and I saw them here again.
wow.
Really good seats. I'm going to every Duran Duran concert that I can. I'm trying to put a trip with the Duran Duran concert. I'm seeing where are they playing. Can I go there? Who will I go with? Go by myself, whatever. And I'm trying to, that's my bucket list. Chase them
Nice.
around like I was 16 years old.
Wow. That's one band I've never seen in concert, and I am also a big Duran Duran fan. I've got all their music on my iPhone and listen to them all the time, actually. And loved Simon Le Bon back in the day,
Oh yeah. He still sounds great. They're all
and
so
hot.
good.
He's hot and he dances. His
1 year,
dancing. We
I don't know
flex.
if it was, I think it was 2006. They were in Toronto. Of course, I saw them then too. But my friend had won tickets to go see them at Much Music, which was a TV show for musical bands. So they were at the doing an interview the day before. She got tickets to go see that. So we were all the way at the end here, and in between commercial breaks, they would come out and sign autographs. And Simon's ass was here, and my hand was right here, but I didn't want to get thrown out. I got his autograph. I got all their autographs that day,
Oh,
but
wow.
so close. It was
That's
That's
so nice.
awesome.
hilarious.
That's that is living the dream. That's the bucket
Yes,
list right there. The chasing
yes,
Simon Le Bon and Duran Duran. That's awesome.
that's it. That's all I want to do.
I was
Well,
hoping he
Hallie,
was on Cameo, but he's not. None of them are on there. So
No, they're too busy for that. But they're on
yeah,
TikTok, so you have to tag them in this.
yes.
you're on TikTok?
Oh,
Yes.
Oh, I
we're
did
getting
not
something
know
for you.
that.
That's our new campaign. That's our new bucket
I know
list.
that Duran Duran has a TikTok. I think John Taylor has a TikTok. Probably Nick Rhodes has one. I don't, and Simon.
Wow.
They probably all do. But
Wow.
Duran Duran does have a TikTok. Yeah.
Nice.
I have to check that out. So we want to be respectful of your time.
Yes.
Hallie, do you have any other questions?
I
for
just want
Javeeda?
to wish Javeeda the very best and longest quality of life possible. Peace and understanding and support for your daughter. And is there anything else that you want us to know about what's going on with you? What's coming up for you besides more Duran Duran concerts, or anything more you want us to know about your process?
And where can people find you?
And where can people find you?
Yeah.
Okay, so we didn't talk about my family and friends' reaction to MAiD.
Mhm.
So I just want to say that it's a very difficult conversation to have with your family.
Mm-hmm.
Yeah.
That my personal and Penny, don't get all mad at them and everything, but don't tell them off. But
What?
yes, we are a Muslim family. You don't do anything to hasten death.
Mm.
So MAiD hastens death. Instead, they want me to consider palliative sedation, and I don't want that. In my last 10 years of life, before any of this cancer and everything, I would just ask God. I'm not strict religious or anything like that, but I believe in God and certain things.
Mm-hmm.
I ask him for a quick and painless death, and I ask him to give me time to say goodbye. And I think he's giving me that with this.
Mm-hmm.
So I'm grateful for that. And my family is a little bit more religious than I am. And so they can't do this. If I want to do it, that's fine. They accept that Javeeda's going to do what Javeeda's going to do. Always have. Nobody's going to change her mind. They're not comfortable with making the call. So
Mm-hmm.
I have to find somebody else who can make the call. I think I have, but that's a big ask as well. And if not, I have to make the call. If I'm well enough to make the call or send the email, I'm not ready to die.
Yeah.
So we're still trying to get together as a family to discuss this and each try to convince each other of what's the best. But I don't want to go into palliative sedation because this is all, in best case scenario, if I had control and everything, with or without MAiD, if I was in a bad car accident and I had 2 hours to live, I want my family around me. I want to say goodbye. I want everyone there to say goodbye. I don't want somebody waiting for a phone call. I don't want people taking shifts at my side.
Mm-hmm.
Yeah.
I don't want any of that. I don't want to be a burden, wasting time. No, I just want to go.
Yeah.
So that's why I'm going down this way. So we will continue to have our discussions, and whatever will come, will come. And my friends, they are accepting of it because they have seen with their, suffering in their lives and everything, and they wish that their loved one had done it. Or they wish their loved one is still able, like I have a friend who's suffering from dementia. She would never, ever want to be the way she is.
Mm-hmm.
But here she is, just living, being fed, in the wheelchair, sleeping all day. That is
Yeah.
no life at all.
Mm-hmm. Mm-hmm.
So I just wish that everybody who finds me, people on social media for some reason say I'm brave. I'm not brave. I get up, I wash my face, I brush my teeth. I may not change my clothes, but I do those things. And I get on with my life. I live my life. I want everyone to live their lives as best they can. I've inspired a lot of people. I've been inspired by so many people on TikTok. And that's why I came here, tell my story, that maybe somebody else, something resonates. And I've had people tell me that this resonated with them or that, and it has nothing to do with death or dying or
Love that.
cancer.
Love that.
That's amazing.
Yeah.
And you can find me on Facebook. I don't want, you can find me. You find me, okay? And on, I am Javeeda for life because I'm all for life. And on Instagram, it's Javex. Don't ask. It's a childhood nickname.
And we'll link all of those in our show notes as well so people can find you. And I
Okay.
promise not to yell at your family or get mad at them.
Don't.
I appreciate that you can respect where they're coming from too and have those meaningful conversations because it's not for everyone. I'm glad that people have the option to do it, and I'm glad that your family's at least able to have the conversation and be supportive of you even if they're not willing to be that person. Thank you for being
so
on.
much for coming on, Javeeda. We really appreciate it.
My pleasure. Thank you for having me.
And if you ever get to meet Simon Le Bon, maybe you come back on and tell us about it.
Yeah.
Okay. To that.
Hey, you don't fuck with the Javeeda.
You don't fuck with the Javeeda.
She was fabulous.
She was great. And that was really enlightening. There were definitely some things about the Canada medical assistance in dying law that I did not know about. I think that Audrey's law, the waiver of consent, I mean, that's fabulous. I love it.
Yeah, that is super interesting. I cannot even foresee in our lifetime that happening, not even federally being recognized. So
no, it's really unfortunate, but I do agree that it may happen someday, but not in our lifetime. It's just too controversial. All right.
She's doing a fantastic job of living the words that we try to say at the end of this podcast every single time.
Yes, absolutely. She is remembering
to live. Yes. Because someday
we'll all be dead.